Hello, everyone, and welcome to this audio podcast. This audio podcast as part of this series, this audio podcast series, in around pathology, the pathology edition. This is an audio podcast. The part of the series, as part of the series, the Typhoon Twixter. This is audio podcast as part of the Type 4 in part of the Type 4 squad, and in this as part of this audio podcast series, there'll be an overview in around some peer review works from 2020 in around looking at a systematic a peer review publication in around a systematic review, and where the systematic review provides has a basis in around healthcare scientists and primary care, and so as part of this audio podcast, audio podcast will as part of this audio podcast there will be a sort of a basis in around the intro to this series. So healthcare and sort of online spaces in context of in context or in remit within the remit of in around health aspects around healthcare, and in around other industries, and other industries has been sort of advancing, and as is the experiences that service users and service providers, thus healthcare professionals and patients who have become accustomed to using sort of online using sort of tech, as well as other sort of modalities to other modalities, in sort of day to day in sort of day to day, and with the with current with some of the main challenges faced by the National Health Service, or NHS, sort of retrospectively, including sort of costs and declining numbers of general practitioners, or primary healthcare physicians, as noted in literature as well, and in line with and also and sort of a decline numbers of health professionals in amongst the nursing profession, in some parts of the world, as documented in the literature as well. There is a demand to better utilize sort of allied health professionals, or AHPs, and expanding data collection surrounding in around particular conditions or diseases, can also can allow, and also allow, sort of a more detailed understanding of not only which patient or patient cohorts or diseases are more suspect or high risk of specific for example, complexities in around particular diseases, as sort of cycle as sort of side causes in around diseases, but also at the same time at the same time having an understanding of opportunities, opportunities for AHPs, allied health professionals, with sort of a knowledge base and expertise, to also be involved in sort of aspects in around frontline practices. So data integration in part, but data integration tech and sort of online modalities could sort of pave the way for sort of transparent sort of initiatives or initiatives for and in around sort of aspects around disease and screening in context of primary care, in context of primary care initially, but also between healthcare sectors. So technology, tech advances, etc., are also known to have in part helped have propagated many industries, including, for example, the banking sector, the healthcare sector, and between sort of other important other important sort of divisions to better sort of staff to better sort of staff productivity, reduce sort of errors and increase sort of service users sort of satisfaction in context of healthcare. Service satisfaction is in context of in around where against different aspects of healthcare and disease. For example, where health professionals use or utilize specific guidelines and guidelines are linked to particular practices. And so technology or tech as well as other modalities are in part a sort of valuable resource in supporting healthcare, and can streamline services and efficiencies, improve sort of workflow and present and better sort of sort of propagate align and propagate and align to and again in around service user satisfaction, service user satisfaction in context of guidelines, thus being sort of reported outcome patient reported outcomes reported outcomes. And this can be seen with the use of varying systems, from automated systems to electronic patient health, electronic patient records. However, it's seen at the same time that the healthcare industry is and has been slow in the utilization of specific tech, and also specific tech, but also but also in the utilization and the sort of understanding in the use of, for example, social media, in line to social media. And so there is a considerable basis for sort of for development or sort of or considerable basis for progress between different varying modalities in context of healthcare. So the NHS, or National Health Service, long-term guideline, a long-term plan, or the guideline that was embossed between was embossed from 2019, recognizes the uptake would transform the NHS, so that digital capability is embedded in routine healthcare, and this includes the provision of sort of apps in context of devices, as well as online consultations and online consultations in context in context on the utilization of electronic patient records, or EPRs. And similarly, advances in tech, especially in empowering patient or service user service user service user service user service user service user sort of service user sort of a service user effort in line with in line with in line with and sort of align with aspects around empowerment. Empowerment can and should sort of be utilized if and where service users can gain advantage in aspects in around healthcare. At present, or currently, tech and online space, or and data integration in the UK, in the United Kingdom, for example, has been inconsistent, and therefore integration of data and analytics could prompt for advancements across several areas of healthcare for particular diseases and conditions, in sort of prospectively, potentially giving an increase or rise to more choice, and where service users can can where service users have can get more choice, or have more choice in aspects of health, in and around healthcare, and aspects around and pertaining to healthcare, but also where service users have choice in line to the sorts of healthcare professionals they will find best sort of support sort of a focus of focus in around in and around in around sort of inquiry, in around inquiry, and also and aligned to particular experiences and scenarios. So that draws this initial audio podcast to a close. This has been a audio podcast as part of the pathology edition, and where this audio podcast series looking at healthcare scientists in primary care. This is a pathology, an audio podcast in around a pathology edition, and part of the Type 4 squad, and part of a Ty4Phoon Twixzter. And this is an audio podcast as part of a Storm Robotics production. Thank you.